I would have to give very high marks to the UAE, to the Kingdom of Saudi Arabia, and many of the other GCC countries for their response early in the pandemic in late February, March, and April, ramping up capacity to be able to manage the initial surge of patients, plus also doing an incredible amount of testing. And as we've seen in both the Kingdom of Saudi Arabia and in the UAE, there has been generally a plateau of new cases on a daily basis. And the new cases tend to be milder, requiring less care. I mean, some care, don't get me wrong, but they're less severely ill on average, and therefore putting less demands on the healthcare system than in March and April and May. We're averaging now roughly about 1,200, 1,300 new cases a day, compared to 4 weeks ago, which was closer to 400 to 500 new cases a day. And I agree with you. I would love to see, as a clinician, I'd love to see the numbers go back down, but we are doing a great deal of testing. Our test positivity rate is still well below the West. And we're really doing an excellent public health job at tracking, tracing, quarantine, and testing. So I'm cautiously optimistic that we're managing this particular point in time as well as can be expected. I think what we've learned, in addition to how good we function, is that really great collaboration also means the need for extending the continuum of care beyond the four walls of a hospital. First thing that Cambridge did is that we were exceptionally responsive to all the acute care hospitals in the region, public and private. And we began admitting some of their long-term patients, non-COVID patients, that were taking up precious med-surg and ICU beds. We were admitting and continue to admit a number of patients who had COVID. They're no longer infectious, but they're still on a ventilator in some cases and need our expertise at weaning off the ventilator. As the population gets older, just as we've seen in Western countries, and even in Asia, especially in China and in South Asia as well, as these populations get older, there's a greater demand on the healthcare system as a whole.